Hello and welcome to At Brookings. I'm Gigi Hinton. Well, we're all still trying to maneuver through this dismal economy as we wait for better days to come. But Brookings experts say what we really need is economic recovery coupled with fiscal sustainability. We'll have that for you. And President Obama has asked Congress to come up with a package of health care reforms. Our experts will examine this complicated issue. And finally, the man on the street weighs in on U.S.-Russia relations. All that's next at Brookings.
This is At Brookings, a review of news and events for the week of July 6, 2009.
Despite a series of fiscal, financial, and monetary interventions designed to help restore the nation's economic health, Brookings experts caution there is much more that needs to be done.
We're in a global recession. It was induced by a collapse of the financial sector. The historical record suggests that those kind of recessions take a long time to dig out of. This is not your father's recession. This is not the Fed taking away the punch bowl, interest rates go up. This is exactly the opposite. The Fed practically threw the punch bowl at people, and interest rates went way down, and still the economy fell through the floor.
A number of our people, often joined by their counterparts in other think tanks, have been bewailing crises, fiscal gaps, and rising debt with increasing anxiety over the past several years. Despite these dire warnings, the Craven Collective, that is 435 reps, 100 senators, and one president, remains unmoved.
Politicians have been playing games with the public, and the public has been influenced by that game playing. The Republican game has been called Starve the Beast, and the idea was you cut taxes, and in depriving the government of revenue, it would eventually force spending cuts to match. And now we have a new Democratic game, which if you were cynical, you could call Feeding the Beast. Fred Hyatt did a piece on this recently, but I've been thinking about it even before that, where that game is that you increase spending and then you hope eventually that you can pivot to raising taxes.
By all accounts, our healthcare system is in dire need of reform. With high costs for care and far too many left uninsured, a Brookings panel says we can't continue along this dicey path much longer.
Legislation has been proposed that establishes a new public insurance plan, requires individuals to own insurance, and mandates that businesses provide insurance for their employees, among other features. Proponents have argued that these steps are absolutely vital in order to save money, improve quality, and provide health care to those who need it. Opponents argue that we should not expand the role of the government in health care, that we should not have public plans competing with private insurance companies, and that the price tag for those proposed changes is way too expensive.
The public cares much more about getting it right than getting it quickly. And when they hear people talk about we need to get this done now, or we need to get it done by some date, it makes them very nervous.
President Obama's new deal with the Russians on arms control, I think I do absolutely trust the Russians. I trust President Obama's decisions as far as whether or not to enter into these deals.
The honest answer for me will be no, I don't think so.
I don't think that the question really is about trusting the Russians on the nuclear deal. I think the issue really is whether or not this actually provides a framework for a discussion to move things forward in the U.S.-Russian relationship.
And that's what I think.
At Brookings is produced by the Brookings Institution. To learn more about the issues discussed on At Brookings, visit our website at brookings.edu.